Reddington Hospital Group has joined forces with the Lagos State Government to introduce the Armoured Shield Medical Centre. It's the first private healthcare facility to be accredited for the testing for and treatment of COVID-19. The accreditation process is rigorous, but Lagos State Health Commissioner Professor Akin Abayomi says Reddington Zain Lab and Armoured Shield Medical Centre passed with flying colours.
Everything here has been done according to the blueprint. The testing, the telemedicine, the admission, the laboratory, everything is top shape. They've passed on all counts, and we're happy to say that we've given them the accreditation for both the laboratory and the inpatient care of COVID-19.
The telemedicine department functions in various roles. One role is that when someone is interested in being tested, we can take questions
In contact with a sick person in the last
from someone who wants to have a test done.
Do you have any comorbidities? Are you hypertensive, diabetic? Do you smoke?
And determine whether they actually need to have a test done.
If you have, can you kindly check your temperature and tell me over the phone? Okay, 38.7, okay.
Having fielded questions from that individual, we can determine the gravity of their circumstances.
Okay, so based on these symptoms, I have to categorize you under the severe category of COVID-19. So you're probably highly suspect of having COVID-19, but there's no need to panic. I'm just going to ensure that I know where you're staying so that we can transport you here to have your test done, okay?
And with that, we were granted access to the testing facility to take a look at what patients can expect at the centre. After paying 50,400 naira, approximately $130 online, patients will be invited to the testing centre to give their details at this contactless reception centre. Experts say polymerase chain reaction, or PCR, is one of the most accurate methods for detecting, tracking and studying COVID-19. That's what's on offer here at Reddington Zain Lab Diagnostics. Samples are taken from two areas of my body. First, a sterile swab is placed towards the back of my throat. Then, another is placed at the top of my nasal passage. The samples are then kept in a labelled test tube. After my sample was taken, it's brought into the testing facility for processing. No risks are taken. Once the sample makes its way into the building, each person my sample comes in contact with is dressed in personal protective equipment from head to toe and the tips of their fingers. Thereafter, the testing process begins, giving us the opportunity to see the state-of-the-art biosecure technology and equipment.
Sample comes into the laboratory. Sample goes in through this transfer chamber. This transfer chamber has a UV light inside that sterilizes whatever it is that is going in and whatever is coming out.
Good afternoon, Mr. Tumen. Yeah, actually, I was told that you needed an ambulance. Okay, so just give me a sec. I'll get back to you shortly. Thank you.
It takes 24 to 48 hours for test results to be released. Should the test be positive, and depending on the symptoms a patient is displaying, the Armoured Shield ambulance will be making a trip from its base in Victoria Island to the patient's home. 30 kilometres away from the testing centre in Victoria Island is Ikeja, home to Armoured Shield's Isolation Treatment Centre. The facility offers 50 bed spaces, a level 3 intensive care unit, labour and delivery ward, and operating rooms for unexpected surgeries.
So for this centre, it's actually where we receive our COVID-19 patients. And these patients could be in different categories. Like the room you're in now is a level 3 ICU care. So this is where patients who have difficulty in breathing and other comorbidities come into this room. If you look around the room, you see there are various equipments which we use. You have the blood analyzer. You have the hemodialysis machine. This is where a patient comes in. Maybe they have some kidney failure, some level of kidney failure. Then we use this machine. Of course, you have your ventilators. You also have your syringe pumps and so on. In every room, as we go through, you also find that we have our HEPA filters, which is really important for the air exchange here. Because we also, as the staff of this particular center, want to be safe.
With Armoured Shield in the arsenal, Lagos State's medical artillery in the fight against COVID-19 just got more sophisticated and even stronger.